Hi, guys. Welcome back for our daily practice questions. It is day 36, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into our questions for today. Question number 1 states a 55-year-old male with a recent diagnosis of heart failure presents for follow-up. He reports occasional shortness of breath with heavy exertion, but otherwise has no limitations on his daily activities. He has no symptoms at rest and is able to engage in physical activity without discomfort. Based on his symptoms, which NYHA classification is most appropriate for this patient? Is it A, Class 1? Is it B, Class 2? Is it C, Class 3? Or is it D, Class 4? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, based on his symptoms, which NYHA classification is most appropriate for this patient? All right, so NYHA classifications have 4 classes, right? Class 1, 2, 3, and 4, based on your symptoms for congestive heart failure, right? And if you don't know, now you know. But that's how they classify it. And we'll get deeper into it. We're going to talk about the questions first, and then you know how to do. Then I'll explain it to you. But here, so they're trying to ask you which classification will we put this patient in, right? So we have a 55-year-old male. He had a recent diagnosis of heart failure. He states that he does have occasional shortness of breath when he is exerting himself more heavily, but otherwise he doesn't have any limitations on his daily activities. He does not have any symptoms at rest, and he is able to engage in physical activity without discomfort. Y'all, this is a class 1. Remember, I always tell you to think of things in ranges, knowing the lowest end and the highest end, and then the rest kind of falls in between. Well, with class 1 of the NYHA classification, they have a heart failure diagnosis, but they do not have any limitations. So here, yes, if he heavily exerts himself, he may have some shortness of breath occasionally, but it specifically says that he has no limitations on daily activities and no symptoms at rest. That's class 1. Class 1, again, you have CHF, but you have no limitations with your ADLs and you have no issues at rest. So no issues or limitations with your ADLs, no issues or limitations at rest, okay? Question number 2. A 68-year-old female with heart failure presents for follow-up. She reports shortness of breath after moderate physical activity, such as walking a mile or climbing 2 flights of stairs. She can perform most daily activities, but experiences fatigue and some discomfort during exertion. Based on her symptoms, which NYHA classification does she fall under? Is it class 1? Is it class 2? Is it class 3? Or is it class 4? Tell me what you got, y'all. Tell me in the comments which one you think. All right, so stem of the question, based on her symptoms, which NYHA classification does she fall under? All right, so we have a 68-year-old female. She has heart failure, reports shortness of breath after moderate physical activity such as walking a mile or climbing 2 flights of stairs. She can do most of her daily activity, but experiences fatigue and some discomfort during exertion. Y'all, the best is B, class 2, because class 2, again, we're working up these classifications, right? So remember in question number 1 where it was class 1, remember there's no limitations. There's no limitations on their daily activities and no limitations at rest. Now class 2, they start to experience slight limitations. They have congestive heart failure, but they'll notice some kind of fatigue, shortness of breath during exertion on most of their like daily activities, but it's not stopping them from doing their daily activities. Okay. And then hold on, let's do 3 and then we'll walk through it. Okay. Question number 3. A 72-year-old male with severe heart failure presents with marked shortness of breath, even with minimal activity, such as dressing or performing light household tasks. He is also symptomatic at rest. Which NYHA classification best describes his condition? Is it class 1, 2, 3, or 4? What do you think on this one? All right. So STEM, which NYHA classification best describes his condition? We have a 72-year-old male with severe heart failure. He has marked shortness of breath, even with minimal activity such as dressing or performing light household tasks. And he's also symptomatic at rest. Y'all, this is class 4 all day, every day. D is your best answer because just like in class 1, there's no limitations with daily activities or at rest. Well, class 4 is the opposite end of the range and scale, right? And so they have limitations all the time with anything they do, any type of exertion, any ADLs, and at rest. When they're having it at rest and on exertion, you always know it's going to be class 4, okay? If they don't have any limitations, it's always going to be class 1. Class 2 and 3 are those ones that I find that reviewers have the most difficulty with because they're not so cut and dry because like class 2, they have slight limitations, and then class 3, they have definite limitations, meaning like let me go back to question 2 so I can show you what I'm saying. So like here, it says she reports shortness of breath after moderate physical activity, such as walking a mile or climbing two flights of stairs. Now, although it seems like, all right, well, she's having symptoms, listen, I don't have congestive heart failure, and I'm going to have some shortness of breath after walking a mile and climbing 2 flights of stairs, right? So somebody with congestive heart failure, we know they're going to have some type of uh symptoms, right? She's still able to do these things and she can perform most of her daily activities, but she does mention some discomfort during exertion, right? Whereas stage 3, class 3 I should call it, it would have said, hey, just walking to her mailbox or walking to her car from the grocery store, she cannot do those short distances or minimal exertion without starting to have this discomfort. Okay, so that's like your progression. Class 1, no limitations with ADLs or at rest. Class 2, slight limitations when there's a little bit more moderate exertion. Class 3, definite limitations with exertion, more minimal exertion. And then class 4, they have the limitations all the time, any exertion and at rest. Okay. All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Again, this is the NYHA classifications, if you want to look those up and review those. NYHA classifications for congestive heart failure. Make sure you know it, familiarize yourself in case you run into any of those questions. But again, be sure to like, comment, subscribe, and share with whomever else you may think may find this beneficial as well. But y'all know what to do. Make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or custom packages or plans, I always tell you either call, text, or email, as I prefer to speak with you to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.